in 2005, I was diagnosed with breast cancer. At the point where I was treated, I was told that my cancer wasn't curable but treatable. And so I've had one recurrence and treated, and here I am. And in the middle there, I had an episode of meningitis, which was pretty scary. When I developed meningitis and became very, very ill very, very quickly, by noon was in emergency, semi-comatose with low blood pressure, and I have to say I remember nothing of this, really. I'm told. It was, I think, really helpful for my husband when the doctor said to him, does your wife have a personal directive? At the end of the day, it was his decision because he was the one I had told and legally designated to be in charge of it. When I think about my confidence in the medical system and whether or not they would abide by my wishes that I've expressed quite clearly in my personal directive, I am confident in that. They asked my husband to go home and get the personal directive so they could see what it was that I was asking them to do or not to do. Really leads me now to feel that it would happen again if I were in a similar situation. And I feel as though the goals of care could be altered at any time that I decided that I wanted to change things. So if I decided that I wanted to be treated really more aggressively than I currently do, if that were medically possible, I think that if I decided I was tired and I'd had enough and I just, really didn't want to go on so aggressively, I think that that would be perfectly acceptable and that my team would be quite open to that. So I don't feel locked in at all to the kind of designation that I currently have. Some advice would be that it's never too early to do some thinking about what you would want for yourself and to write it down. And the format in the green sleeve is a perfect way to do it if you want to express it in your own words. But I think it's really, really important to discuss it with your family because actually they are by and large, they are the people who will be your agents and will follow through.